Hi, Facebook fans and family. We're just coming to you live this afternoon, and what we want to discuss today is more informational than self-care tips. This past week, we've had a lot of patients come in. They've asked about, do you guys do anything for the shoulder, for the hip, or for the foot? And a lot of people, when they think chiropractor, think only the spine related, but we do, at Integrated Health and Wellness, we do a lot of evaluation with the shoulders. We take care of a lot of the hips, a lot of knees, a lot of ankles and feet. One of the bigger things that we do also is a foot evaluation, and we give you some recommendations on various types of shoe support. We work closely with Browns. We'll give some ideas, some tips that you can take down to Brown's Shoe Fit and to get fitted for a shoe. Another thing that we use for some patients that need a little extra cushion, a little extra support, that are on their feet quite a bit, is a pretty nice little generic shoe insert. And so we can go into that a little bit later at another time. But today, what I wanted to go over and just kind of let you guys see and experience is a foot adjustment. And so I know that Dr. Ram doesn't have any issues with his feet as far as we need to do orthopedic testing, which that was something that we would do first, is orthopedic testing. What's the problem? Is there something else we need to do first, an x-ray or an MRI? But today what I'm going to do is go over a foot evaluation, a foot adjustment, and then we'll go from there. And I'm going to kind of talk through this as we go through here. Go ahead and scoot over this way for me. The first thing that I'm going to check is just more of the heel area. The heel area is something that's pretty commonly locked up with patients that have plantar fasciitis, actually Achilles tendonitis, heel spurs, heel pain, that type of thing. So I'm just going to go ahead and evaluate here, and right there he's just a little locked up. I'm going to give you a quick little adjustment, and that's all it takes there. Another area of pain is the inside of the foot or the outside of the foot. Generally also, if there's an ankle sprain, this joint right up here can get misaligned or not move very well also. And so I'm going to check that area, and generally what that's going to look like is a quick little adjustment here. Good. On the outside of the foot, there's another little bone right on the side here. That there's a lot of little bones that articulate together that create a lot of different joints that need to move well. And I'm going to adjust right out here on him. Good. And then also a common condition that people have is a flat foot or overpronation problems. And so the joints right in the midfoot can actually get locked up or not move very well. And that's not too bad on him there. Another thing is forefoot pain. And so there can be some pain that actually people will complain of right underneath the ball of the foot. Big fancy words are metatarsalgia, Morton's neuroma, those type of things. And so these joints through here can actually get locked up and not move very well. Another common thing is a bunion. The big toe can actually start to create pain or become painful. And I'm going to check that right there. And then also just going to check the little toes and just mobilize those to allow them to feel better. There's a lot of different things. So that's the foot adjustment. It's a pretty generic foot adjustment that we'll do. Sometimes we need to get a little bit more specific with patients just depending on their condition. There's other things we do with it as well. Taping, we may do some soft tissue work, some dry needling, some muscle stim. But that's the foot adjustment. If you guys have any questions or comments, please leave those down below or give the office a call at 620-504-6344. Also go to your YouTube channel. There's a lot of other videos that we have done in the past that relate to the foot. So if other questions, or if you want to see some of the self-care tips, those are out there as well. Well, thank you and have a great weekend.